Hello everyone, my name is Abdullah Tor. I'm a medical student in Cairo University. Today, we are going to dive deep into the critical role that elective healthcare plays in global health systems, especially focusing on hernia surgery, using it as a tracer condition. Under the guidance of my remarkable mentor, Dr. HIPPO, consultant of pediatric surgery, I will be presenting to you a fascinating article that was published in July 2024 in the Lancet Global Health Journal. We have included the link below so you can scan the QR code and follow along with us as we continue this presentation. This research in particular has been quite an interest for me on a personal level, as even though elective care is labeled as a non-urgent procedure, its timely provision prevents emergencies and ensures patients can return to their day-to-day life quickly. Hernia surgery, especially inguinal hernia surgery, serves the role of a tracer condition for assessing both access to and the quality of elective care around the world. In this project, perfectly, because it is a very commonly recognized procedure worldwide with the added benefits of being cost-effective and having a clear treatment and guidelines. Elective care is a fundamental component of a functional healthcare system, defined as medical procedures and surgeries which are not life-threatening but plays an astounding role in managing a wide range of health issues before their escalation and progression into emergencies by early intervention, optimizing resource utilization, reducing costs in the process. For instance, inguinal hernia repair, when postponed, can evolve into an emergency requiring bowel resections and potentially causing severe complications. The study I'm discussing analyzed data from more than 18,000 patients across 83 countries, offering important insights into the global efficiency and quality of elective care. In order to get a clearer picture regarding the access to and the quality of elective hernia care globally, a variety of key metrics were put to use in the study. These metrics were mapped to the World Health Organization's health system building blocks and are essential for evaluating system performance. Starting off with the axis. Number 1. Emergency surgery rates. This metric measures the proportion of patients undergoing emergency hernia surgery. An opposite correlation was found as countries with poor elective care often have higher emergency rates, which was a subsequent result of untreated hernia worsening and requiring urgent intervention. The study showed an increase in emergency surgery rates from 6.8% in high-income countries to 14.2% in low-income countries. Bowel resection rates. Emergency surgeries are often accompanied by bowel resections, which increase complication risks. As elective surgery access decreases, bowel resection rates climbs, another indication of the strain on emergency system. The graph highlights a massive increase in bowel resection rates from 1.2% in high-income countries to 4.2% in low-income countries, which indicates that delaying the elective hernia repair results in more complicated surgeries with worse outcomes in low-income settings due to the delay in receiving prompt care and lack of access to resources. Waiting times. The study used waiting times as a proxy for access. The median wait time for elective hernia surgery was 8 months globally, with variations across income groups with 8.2 months waiting period in high-income countries compared to 5.9 months in the lower middle-class ones. It's also worth mentioning that, interestingly, the delay is often not in receiving surgery, but in receiving a diagnosis, highlighting the need for a better referral system. Moving into the quality. Day case surgery rates. Day case surgery, where patients are discharged the same day, is a sign of an efficient and well-functioning elective care system. The study found that day case surgery rates were low across all income settings, with a 50% in high-income countries and a 44.5% in low-income countries, indicating room for improvement. Mesh is the gold standard for elective hernia repairs. According to the study, the use of mesh significantly decreases hernia recurrence rates, which improves patients' outcomes. In high-income countries, mesh is used in 97.6% of hernia surgeries, while in low-income countries, this figure drops to 61%. The disparity points to the unequal distribution of medical resources globally. However, despite its effectiveness, mesh use remains an equity issue in global health. The study highlights the urgent need for global efforts to improve mesh availability in low-income countries. Addressing these gaps can enhance the quality of elective care and reduce the reliance on emergency interventions. There are many well-documented advantages of using mesh repair, including but also not limited to lower recurrence rates. Mesh significantly reduces the chances of hernia recurrence because of its ability to reinforce the weakened abdominal wall, which leads to fewer reoperations and better outcomes for patients in the long run. Faster recovery. Patients with mesh repair recover faster more often than not in comparison to traditional tissue repairs, which opens up the gate for their eventual return to their daily activities faster. Cost efficiency. Despite having higher initial costs, mesh repair ultimately reduces the overall healthcare costs by minimizing the need for repeat surgeries and complications. Reduction in emergency surgeries. Access to mesh reduces emergency hernia repairs, which are more complicated, riskier, and costly. The aforementioned combination of drawbacks of emergent hernia repair justifies the push for wider access to mesh, especially in low-resource settings. Post-operative complications. The overall post-operative complication rate was 13.4%, with higher rates observed in emergency surgeries, which had an adjusted odds ratio of 2.06. Complications tracked using the Calvian-Dindo classification system were more common in emergency surgeries and bowel resections, highlighting the critical importance of timely elective care. In conclusion, the global disparities in elective hernia care, particularly in the use of mesh, highlight critical areas for improvement in health systems. By increasing access to mesh and improving elective care pathways, we can reduce the burden on emergency systems and ensure better outcomes for patients. The study underscores the need for global collaboration to strengthen elective health care, especially in low-income settings. I hope this study will be a catalyst to focus our efforts towards a brighter future, one where the word emergency becomes more and more of a rarity with time. Thank you, and we hope you enjoyed this presentation.